I'd like to share with you some findings of our research group on the use of whole body cryostimulation, which you probably know from it gained popularity in a sports field because of recovery from muscle fatigue. And in the medical field is a quite neglected treatment modality. With the exception of Poland, there is some Polish guy here, and Poland is the only country that reimburses whole body cryostimulation for the treatment of mostly osteoarticular and also multiple sclerosis patients. In Italy, we had 1.5 years ago this recognition from the Ministry of Health. This is a technical document that says that whole body cryostimulation can be safely used in those conditions for muscle recovery, for fibromyalgia, for obesity, for mental well-being, meaning depression state, and for rheumatic diseases. Well, it all starts with a thermal shock. The thermal shocks activate the thermoceptors in the body, especially in the upper part of the body. They signal to our control center, the hypothalamus, which controls the temperature in the body. And if the cold is signaled, they generate mechanism for generating temperature, thermogenesis. And those mechanisms are mostly through the shivering, so the activation of muscles through the somatic motor neurons, or through vasoconstriction, or another mechanism we are seeing in a minute, which is the activation of brown adipose tissue. What happens with vasoconstriction? Vasoconstriction redirects the blood flow to the core. This blood flow increases the cardiac output, and the cardiac output means that the blood flow to the muscle, to the periphery, is increased fourfold. So that increases the removal of catabolites and also stimulates the aortic baroreceptors. This higher pressure stimulates the aortic baroreceptors that in turn increases the parasympathetic response. So the final effect of whole body cryostimulation is an increase in the parasympathetic tone, which is important. It's interesting because cold stimulates the muscle exactly like exercise does. In an exercise mimic infection. So it stimulates the muscle to produce myokines, as we have seen, and especially irisin. Irisin is a myokine that increases the so-called browning of the white adipose tissue. What is the brown adipose tissue? Is this one. You see the different histological different structure. The white is for storage, storing lipids. The brown is for burning fat, so thermogenesis. The humans brown adipose is a feature of humans. We have much brown adipose tissue in the newborn, because the newborn, when comes out of the uterus, has to face a thermal shock. So he needs to generate heat. Then that brown adipose tissue, which is mainly here in the parasternal subclavicular area, get atrophied because we dressed up, we heat a lot our environment. So but it can respond to cold. Eskimo people or people who live in very cold environments, they have more brown adipose tissue. And brown adipose tissue increases the energy expenditure. So it also, as we will see, have metabolic effects, like an increase in insulin sensitivity and glucose uptake. This exposure to cold can be listed among the so-called hormetic strategies. Those are strategies like exercise, like intermittent hypoxia, intermittent fasting. There are all strategies that are aimed to improve the mitochondrial function. You know, mitochondria are our energy cells. They produce more than 90% of the ATP. And it is thought that mitochondrial dysfunction is probably at the origin of many, many neurological conditions, and not only neurological. For instance, the neurons in the brain have a high density of mitochondria, and they consume 20% of the whole energy expenditure. And also the discovery by those guys of these channels that are sensitive to temperature has boosted this research, especially those TRPM8 channels that respond to cold and reduce the signaling of pain. I go quickly because I have been threatened by the. This is a picture from the laboratory in the hospital where we use this machine. It's a liquid azote machine. The vapor you see is just water vapor. It's breathable air. It's nothing dangerous. The azote liquid is only in the walls of the machine. We have some protocols exposing patients at a temperature of minus 110 degrees Celsius. Now we expose them for 3 minutes. And we provide cycles, 10 sessions of that treatment. And before and after, we measure a lot of things in the blood, in body composition. Of course, there are contraindications. There are cardiovascular. If you had a cardiac attack a week ago, you cannot go in. If you had an uncontrolled hypertension, you cannot go in. And also, if you had a history of strong chronic migraine, you cannot go in. There are temporary contraindications. We have an international group with the French and Polish colleagues, and we have recently updated the contraindication for this treatment. The effects, the range of effects is very wide. I told you there is the ultimate effect is a reinforcement of the parasympathetic, and that leads to a reduced sensation of fatigue. Is a very energizing treatment, especially if you think about multiple sclerosis of Parkinson. Patients feel this treatment as very useful for their energy. Also, it has an anti-inflammatory, antioxidant effect and an effect on body composition. It is, in my view, it is a very rehabilitative treatment because it addresses our relational organs mainly, our muscle, our bone, our brain, the organs that allow us to interact with the environment. I try to condense in one slide all the effects we have found so far, testing the whole body cryostimulation on different patients. And you see, does the pointer work? Yeah. You can see, for instance, starting from the reduction of inflammation, this is a very quick effect. And as a result of that, we use it in a person who have a high inflammatory status like rheumatoid arthritis, ankylosing spondylitis. Fibromyalgia is not inflammatory, but it works for other reasons. As said, we have an increase in parasympathetic tone, and that helps patients with Parkinson, with long COVID. We used it very much with sleep disorders, with depression. Also because we have a release of endogenous opioids, beta endorphin. We have an increase of antioxidative activity. And for the same reason, it can be useful in Parkinson, multiple sclerosis. we have an activation of the brown adipose tissue, and therefore we use in these metabolic patients. We have a very important analgesic effect through the activation of those channels I showed you before, and a neuromodulation. So we used in several types of chronic pain, centralization syndromes. We use it, I remember this case of a young Paralympic athlete with a phantom limb pain, resistant to anything. And he responded very well to a cycle of whole body cryostimulation. So that was a very interesting case. And also this increase in perfusion and that can reduce the muscle sore and so on. Currently, we are using it mostly in a patient with obesity, with fibromyalgia, with Parkinson, with multiple sclerosis. We have done a scoping review. There are 10 papers on the use of whole body cryostimulation in obesity, and you can see that they are all aligned that this treatment can increase functional performance, can increase the quality of sleep and the health status of patient, decreasing the severity of pain and improving the lipid profile. A few weeks ago, I came across this Finnish study, which is more or less in line with what we found, that shows that cryostimulation improves glucose and the lipid profile, but did not affect, at least at this dose, did not affect weight loss or the activation of BAT. We did some experiments trying to have a sham control, trying to have people in the chamber with a higher temperature. That was the highest we could reach was minus 55 degrees Celsius. And interestingly, we saw that the effects was proportional to the dose of cold. In what we imagined was a sham treatment, so at higher temperature, we still had effect on improving cholesterol, glucose, and so on, and also on the increase in parasympathetic tone. We use it just a brief overview of the example we are using. We have recently published this that show that increases the range of motion of is not a frozen shoulder, it's just a person who with a limited range of motion because of posture, and rehabilitation together with whole body cryostimulation increases the ROM. As I told you, we used it in a fibromyalgic patient, and also at 1 year follow-up, we measured an improved quality of sleep and general well-being. We used it after the COVID wave in the rehabilitation of those patients, because the benefits are overlap with which were the symptoms of COVID. So the neurological symptoms, the depression, fatigue, myalgia, and even the pulmonary symptoms. We used in patients with chronic pain, central sensitization from different causes, from post-traumatic, post-surgery, rheumatic conditions, and so on. Because this exposure to cold increases, as I told you, the anti-inflammatory responses and seems to modulate the neurotransmitters involved in pain signaling and increasing the analgesic factors, the endogenous analgesic factors. Those are, again, examples of clinical application. We used it in a patient with spasticity, in an adult with cerebral palsy who underwent different kind of treatments, included botulinum toxin. And I'll show you the paper in a while. And you can see also other example of post-COVID or rheumatic polymyalgia. This one, for instance, was the mother of one of our physiotherapists. She, after a cycle of whole body cryostimulation, decreased dramatically the use of medication, of cortisone, and improved the quality of sleep, reduced the pain, improved her daily physical activity, and the results were quite striking after just one cycle of WBC. Fibromyalgia, they respond very well. It's not just us that report that. There are different groups reporting use in fibromyalgia. And we can see effects that last for 3-4 months after a cycle. In this follow-up study, we see that the reduction in pain and improvement in sleep quality and general well-being lasted for 3 to 4 months. So it could be, of course, we need our small studies. We need more multicentric, more numerous studies. But it seems that WBC is a safe and feasible alternative to other cooling methods that were used in the past, like that are a little bit unpleasant. If you try the water immersion in ice, it's not that comfortable. This is a quick exposure, it's 3 minutes, and is very, very effective. And it also, the fact that it mimics exercise makes it a possible alternative intervention to exercise in those patients, which are many, that suffer from pain, inflammation, functional impairment, that cannot engage in physical activity in an early stage. So interesting effects. What about the neurological condition? We know that the central nervous system is very vulnerable to oxidative injury, and basically many neuropathologies, Alzheimer, Parkinson, multiple sclerosis, have inflammation, oxidative stress. So those are features of many conditions. We know from Polish study, from our Polish colleague, that WBC is effective in improving functional status and fatigue, which is one of the main symptoms in patients with MS. So this is already established. Multiple sclerosis is a very thermosensitive condition. And we too conducted this scoping review on something like 13 studies, I think, yes. And we saw that they were all aligned in a reporting that WBC reduced fatigue and improved functional status with no adverse effect. That's also very important because it's a very well-tolerated treatment. It gives you a sensation of pleasure immediately. So it's nice to have something you don't have to suffer for. Also, it's interesting because the many chronic fatigue syndromes or stress is related to this insufficient function of the hypothalamic pituitary adrenal axis. And if you look at the two columns, exposure to cold seems to counteract exactly those issues. And also, it has been used by Polish, but this Dr. Rimaszewska is a Polish colleague who used it in the depression, patient with depression. And one neurobiological hypothesis of depression that is based on a dysregulation of this hypothalamic pituitary adrenal axis. We tried that on Parkinson, and we looked at the heart rate variability, which is a proxy of the sympathovagal balance, assessed through the ECG. And to make it short, we saw that there was an increase in a variability, meaning there was an enhanced parasympathetic activity. And also we measured an increase in serotonin, a decrease in cortisol, and a decrease in all the scores of anxiety. So it seems that also the effect on sleep, on stress hormones, on psychological well-being, Parkinson are there. And therefore, we continue to study that in Parkinson because it is promising. I was telling you about the spasticity case, and this is the results we had with the reduction on the Ashworth scale, with an increase in joint mobility, in well-being, and in quality of life. It seems that cold reduced the spindle activity in the muscle due to cold, and also reduces the clonus and the spasticity. So we think it could become a booster in many rehabilitation conditions. An adjuvant is not the only treatment you would prescribe, but is an adjuvant to rehabilitation. Of course, we need to personalize treatment. We need more data. We need to, but as you see here, the studies are increasing. The number of studies worldwide is increasing. Thank you.